All right, I'd like to then introduce Melissa McGuire of the Illinois Association of Free and Charitable Clinics to talk about free and charitable clinics. Welcome, Melissa.
Hi, thank you for inviting me to the call. I don't have prepared slides for the call, but will gladly send information if you send information after the call to the participants.
We will.
Great.
Most certainly.
Thank you. So free and charitable clinics have been around for over 40 years, and we provide healthcare to the uninsured and underinsured. And free and charitable clinics in Illinois, there are 52 of us, and around the country there are 1,400. And what we kind of pride ourselves of doing is kind of meeting the need and filling the need as the community needs change and evolve. Free and charitable clinics can be a freestanding, they can also be a mobile, and they can also be a clinic without walls. And so one of our members that we're most proud of is Access DuPage and DuPage Health Coalition. So I will defer to Kara's presentation about the great work that she does as a clinic without walls, and you all know her far better than you know me. So what I just wanted to talk with you about is kind of the, when we talk about testing, treatment, and recovery for COVID. When the pandemic initially hit, many of our clinics did not do testing. What they did is they pretty much pared down care to telehealth and try to identify the most important critical healthcare needs of their patients, primarily chronic health patients, in order to keep those patients out of the emergency room so that they maintain their health and their health status. As we've talked about, they're very much at risk. Our clinics have really looked at providing healthcare through telehealth, but also are really very much aware of the relationship with the patient. So for a patient to get care in a free and charitable clinic, as you know, it doesn't matter their status. It doesn't matter whether they've had a job or not. And so many of the patients that are coming to the clinics are fearful of getting tested. They're fearful that by getting tested, will my information be put somewhere into some system? So our clinics do an awful lot of trust building and relationship building and try to refer them to you for the testing. We've had some of our clinics are doing testing and doing some treatment and recovery. Just as what was talked about before, many of our clinics are struggling with having enough PPE. In Illinois, free and charitable clinics do not qualify for state funding. Many times the reach out for the Department of Public Health has come through other arms, have reached out and said, we have some PPE that we could provide for your clinics. And at this particular time, our clinics are not getting information about that, as well as testing. I think one of the things that happened initially when the COVID pandemic, many of our clinics rely on students and retired physicians for care. So as you can imagine, when the med schools closed and they lost their volunteer corps, many of our clinics started having to redefine how they provide care. What I would like to say, like all of us, is I'm just so proud of all that our clinics have done. At this particular point, I only know, initially there were about 7 or 8 clinics around the state that said they had to close, and right now I only know of about 2 or 3 that are still closed. Many are providing telehealth in various and sundry ways, partnering with different clinics in different ways in which they provide healthcare. If you are looking for a free or charitable clinic, our website has a list of clinics. And so the types of calls that I'm getting for people that are looking for healthcare are people that are traveling from another country and they can't travel back home, and they're having a hard time understanding the system. And so, and or family members. So they have a relative that's come from another country and they don't have their medication. And so now they're trying to figure out how to get the medication for that relative. So I'll refer them to one of our clinics to help them do that. And now that I have this great information from this call, we'll also put it on our website. So when we're talking about testing, treatment, and recovery, the gaps that we're seeing right now are those people that might be fearful of going into the traditional system. I was just talking with the clinic the other day, and they had one person that was 19 years old that tested positive for COVID. And typically our clinics serve older, and there were 16 people living in the home, and they were fearful to come and get tested. And the clinic was working really diligently with that young adult to have that family go in and get testing. The other thing that our clinics are seeing that, again, I'm pleased to be on this call, is, as we've talked about, is the new uninsured. What the clinics, they're trying to kind of gear up for the resurgence of unemployed, and they're saying they kind of look like they're deers, like they're deer with their heads caught in the headlights. Like, I've had a job, now I've got to figure out how. So understanding how to navigate and having these resources that you've shared, we'll put on our website, we'll share with our members, is going to be critically important, because for many of these, as you know, this is kind of new, uncharted territory for them to access resources. So please, I'll send our website, I'll send our resources, and really appreciate the opportunity to be on the call.